получилось.
In Washington, House Minority Leader Hakeem Jeffries is criticizing President Donald Trump, saying he has been missing in action. As the federal government shutdown enters its third day, this comes as efforts to break the deadlock has failed once again in the Senate. Let's listen in.
Throughout this week, Donald Trump has been missing in action. He remains in the Presidential Witness Protection Program. House Republicans are on vacation all across the country and the world, and Senate Republicans continue to vote on the same partisan Republican spending bill that's dead on arrival because it guts the health care of the American people. Donald Trump and the Republicans are not behaving responsibly. They're not behaving in a serious manner. They don't want to reopen the government, and they certainly do not want to address the health care crisis that
While Republicans have accused Democrats of holding out for over $1 trillion in additional spending, Democrats, including Senator Patty Murray, criticized Republican plans for failing to address a growing health care crisis. Let's listen in.
On health care, they've decided to shut down the government rather than work with us. And they've decided they would rather make up lies about illegal immigrants than talk about the actual issue at stake. The reality that Republicans are letting premiums more than double. Newsflash, Republican areas are actually going to face some of the biggest price jumps if they refuse to save health care. Small businesses are going to take a hit, not to mention farmers. 1/4 of our farmers are covered on the ACA exchanges, so this healthcare crisis is a big concern for them. Millions of families across the country are about to see their monthly healthcare costs jump by hundreds, if not thousands of dollars. And the Republicans' plan here seems to be, I hope no one notices.
Meanwhile, Democrats are vowing to stand firm, demanding the distribution of health care subsidies stripped from the Affordable Care Act before agreeing to any funding deal. Now for this discussion, we're joined by Ross Feingold. He's a political analyst, joins us live from Taipei. Thank you very much, Ross, for joining us again. Good to see you. Now, what are the risks and immediate, as well as immediate economic as well as social impacts of this U.S. government shutdown?
Certainly the impact of a government shutdown is enormous on the economy because of the large role that the federal government plays, and not just the hundreds of thousands of employees who work for the federal government, who spend their salaries, and many of them are being furloughed at the moment. They're not receiving their salaries. But also because of the federal government's role in dispersing funds to all sorts of recipients across the country and in different parts of the economy, whether that's to state and local government agencies that receive money from the federal government, small businesses that receive funding from government agencies. The list goes on and on. So certainly this, if it is prolonged, it would have a significant effect on the U.S. economy for the current period. Now socially as well, again, the disbursements made by the federal government are an important part of the social system. Now, many of those disbursements would still continue during a shutdown, but some of them will be affected. And then also it's the social fabric issue. What does this do politically? It just further inflames the partisan divide that we have in the United States as people who support one side or the other get mad at the other side.
So if you can clarify, what are the main points of contention between Republicans and Democrats right now?
At the moment, the main point of contention appears to be the level of federal spending that goes to certain healthcare programs and helps keep the health insurance premium for millions of Americans at a lower cost point than it'll be in the absence of these subsidies. Now, the Republicans, who obviously control the White House and control the Senate as well as the House, they passed a bill that they like to call the One Big Beautiful Bill in July of this year, which reduced some of those federal government subsidies for health care. And the Democrats want to use this opportunity to, where we're debating the 2026 fiscal year budget for the federal government, to put some of that money back, to make those funds available again to states, and then it ultimately flows down to individuals buying health insurance. And the Republicans are saying, we dealt with this issue a few months ago. We don't want to change our position. Our view is that we should reduce some of these subsidies. And the Democrats are saying, you're hurting low-income people who relied on some of these subsidies to access health care in a more affordable way. So the gulf here is huge. Part of it is not just an argument, who could win the argument this week or in the coming days and weeks, but also just a conceptual gap between what the role of the federal government should be in providing health care to Americans. And we know that in the United States, many people really don't think the federal government should have such a significant role in funding health care, which is a different model than we see in many other parts of the world.
Yes, building on that answer, Ross, as I know you are in Taipei, how do you see from outside U.S., how do you judge their healthcare system, and what do you think is very different from healthcare system particularly in Asia and in U.S.?
A lot of places in Asia do have some form of government healthcare or government-provided healthcare system, or a mixture of government-provided care along with private insurance. Here in Taiwan, where I live, it's a fully national healthcare system, and healthcare is delivered at a relatively low cost. But again, that's just not been the model in the United States, and many people still oppose that. Certainly, I would say there's a growing number of people in the United States who recognize that healthcare in the United States is extraordinarily expensive and doesn't necessarily deliver good outcomes for that high price. Even President Trump knows that, and that's why he recently negotiated with pharmaceutical companies lower drug prices at which the drugs are sold in the United States. But is the United States ever going to move to a European-style, fully government-run healthcare program? I think the chances are very unlikely anytime soon.
Right. With that, I would like to thank Ross Feingold for joining us and sharing your insight as